Hi, I'm Joe Chili, mornings from 7 to 9 a.m. on Buffalo's oldie station, the Big Weck. Joining us today on the Big Weck's Buffalo on the Rise is Dr. Christian Miliotto. How are you doing today? I mean, what are you doing today? How's your day going so far?
Fantastic. I just finished up one of my educational seminars, met a lot of really cool people, got to teach people about nerve and joint disorders, how to advocate and take control of their own pain, and it's one of my favorite things to do.
How do people react to this? Is it really like a training session, or do you get them just to recognize what their pain is and not have to take some artificial substance to mask it?
I mean, it's entertaining. Usually I start by saying, how's everybody doing? What do you know about me? And most of them are like, oh, we saw you on TV, or we know you do stuff, but we're not really sure what you do. And I always joke with them, and I'm like, so you came to a seminar to learn about stuff, and you have no idea who I am, But no, actually, it's a lot of fun. I mean, we do a lot of laughing. We do a lot of different things to show people about how our body's affected. We teach people about nerve and joint disorders, medications they're on. And, really what I want people to understand is when it comes to the musculoskeletal system, our bones, our joints, our ligaments, our discs, our nerves, our spine, that there's no magical solution to treat these things. And a lot of people that come to me, they tell me, I've done everything under the sun. I've had injections. I thought about surgery or did have surgery. I did PT. I did this. I did that. But then I heard about you, and this is different. And it's a conversation about what evidence and research-based treatment is and the goals we're establishing, and taking a person that has been in chronic pain for years and helping them eliminate that pain and regain their function and actually live the life that they want to and deserve to live. That's what it's all about.
What do you think is the biggest thing that sets you apart from other doctors doing similar work in the area?
So we're all very unique. The technologies I use are completely different than everyone in the area. From the laser that I use to the nerve therapy to even my technique with decompression. We're certified in decompression, and we do it very, very differently, which is one of the reasons why I think we're so successful with people. Medicine's not perfect or guaranteed, but and it's also the compassion. When people meet me, they do see I'm very empathetic, but I care. I really do care. I want everyone to get better, and you have to have a mutual trust and respect when you're working with these types of conditions. These aren't people that are coming in who've had pain for a couple days and they're going to be fine. These are people who have had pain for months, years, and decades, and surgeries and injections, and they feel defeated. And we have to help them by being compassionate and caring and providing the right therapy and communicating. Healing is not a straight up line. We want people to understand how the body's healing, what you're noticing, and then we evolve that treatment through the course of their care.
What do you tell people? Like when I went to you and I had pain, I had muscular pain, shoulder pain. And you did laser on me, and it wasn't something, the first thing they asked me when I left, someone said, was it painful? Because, you hear laser's got to be painful. Because they think of lasers as cutting, right? Or whatever the case may be. What do you tell somebody if they come back the next week and say, well, I feel a little bit better, or I don't really feel anything yet, just a week later?
Yeah.
What do you say to them?
Well, that's part of the evaluation. When we do a comprehensive clinical diagnosis and evaluation, I sit down with you for about an hour to an hour and a half. I go through your imaging, I do ortho, neurologic assessment, muscle testing, reflexes, your individual case history. And once I've formulated what's going on and we have a proper diagnosis, I then go through the therapies and what the expectations and what the patient's goals are. So we establish that right off the bat. And it's really cool to see how people are starting to understand that. Like, today, for example, I had 3 patients that I treated. They were all their second treatment. My first 3 9 a.m. patients, it's their second treatment. They did a treatment 2 days ago, and all 3 of them responded exceedingly well, even past what I had thought. My one patient, for example, told me, she said, Dr. Miliotto, I haven't walked long distances in 8 years. And one of my goals was to walk to the flower fields I like to go to. She goes, I did that after my first visit, and I didn't have pain, and I didn't have the sciatica in my leg. I can't believe it happened that quickly. Everybody's obviously different, but that's the understanding that the treatments we use are not painful. They don't have negative side effects. Laser therapy actually feels extremely comfortable.
It's good, yeah.
Most people on spinal decompression fall asleep, and our nerve therapy that we use is actually designed to turn pain off. So we're establishing healing from start to finish. Everything is comfortable.
Yeah, I think that's really interesting that you say that. And you have that chair that you put me in every couple of times too. And it was just, that, really, felt good too. But all the different types of therapies, because you can go into one room there and you see a bunch of different things going on.
Yeah.
You know what I mean? I mean, I would have to ask you, what's that person? Not asking persons' names or personal things or things like that. So what's the first step right here? We've probably got just a minute and a half or so left. What's the first step for people if they're watching right now and they have questions?
Give me a call, 650-7246, schedule an evaluation, come in for my seminar. You can go to buffalopainrelief.com, take our pain questionnaire, take a look at the technologies that we use. But the best thing you can do is advocate for yourself. If you feel like you're struggling and you have these symptoms going on and you want to try something or learn about something you can do that you haven't done before or seen, give yourself that opportunity. It's the least you can do is sit down, because I will go over everything and thoroughly explain what's going on with your condition and probably teach you things that you didn't even know you had going on.
All right, Doc, thanks. I appreciate it. For more information and answers to your questions, contact WNY Pain Relief by calling 716-650-PAIN or go to buffalopainrelief.com. Sponsorship and promotional consideration for the preceding segment was provided by WNY Pain Relief, and you can join me weekday morning 7 to 9 a.m. on The Big Whack.